Assalamu alaikum. This is Sobia Tabbasum from the Department of Biological Sciences, International Islamic University, Islamabad. I'm very much thankful to the organizers for taking me online today. So I'm going to share my presentation with all of you. Well, the topic of my presentation is BRAF mutation analysis as a predictive tool for prognosis and diagnosis of thyroid carcinoma in selected Pakistani population. So before discussing the details of this mutation, I just want to go through the introduction of thyroid cancer, what actually it is. Thyroid tumor is actually a heterogeneous group of neoplasm that arises from different types of the cancer cells that are present in the thyroid gland, which looks like a butterfly in its shape. And there are different types of this thyroid like anaplastic, papillary, medullary, and follicular thyroid. But we have selected papillary thyroid carcinoma because of its prevalence in Asian population. So with respect to its prevalence, it ranks at the 9th place for the incidence rate among all the cancers, and papillary thyroid carcinoma, it constitutes up to 90% of the thyroid carcinoma, which is very high in its incidence in the contemporary series. The rate of thyroid cancer, it is being reported 3 times higher in the women than in the men. And there are certain acquired factors that have been well established that are linked with the etiology of thyroid cancer, and genetic factors, they are also known, but in research needs to be done on most of these genetic factors that have been ignored, particularly in the Asian countries. The known genetic causes of thyroid cancer, they include the point mutation in some of the genes like BRAF, RAS, TERT, RET, and TP53 genes, and some other fusion genes. We have selected BRAF gene to carry on the analysis on this gene. What is the BRAF mutation and how it occurs in this gene? Actually, BRAF gene that is located on chromosome 7, it shows a substitution, and it shows the replacement in the form of the spontaneous change at 15th exon, that the hydrophobic valine is basically replaced by the glutamic acid, which disturbs the interaction between the activation segment and the P loop, that leads to the marked increase in this BRAF protein, and the system will kept on the switch on mode, and this will lead toward the permanent activation of this BRAF protein, and this result in the uncontrolled cell division and growth that can lead to the lethal condition, that is cancer. The BRAF V600 mutation basically is very most commonly found in different types of the cancer, and again there are different forms of BRAF V600 mutation, including V600E and K, but we are basically interested in V600E. That is the most common form, and it is present in almost 40 to 45% of the PTC cases. Therefore, checking the BRAF V600 mutation in the tumor tissues, it can help to plan the targeted therapy, to plan the precise source of medicine at the population level as well as at the individual level. The MAPK pathway is basically involved in this cancer, especially in the papillary thyroid carcinoma, and the epidermal growth factor receptor is basically that's present on the membrane. Upon it, the activation of this receptor, the signals will go on, and there is the activation of BRAF V600E kinase protein. So the medicine can be designed to inhibit right at the membrane level to block this receptor, and also medicine or the inhibitors can be designed to block the expression or the overexpression of this BRAF protein. What are the worst consequences of BRAF mutation? Actually, very poor sort of prognosis and very frequent problem of disease reoccurrence. They have been linked with the papillary thyroid carcinoma, that makes this disease very much higher in its incidence, and people, they are not getting any sort of efficacy from the radioiodine therapy, and it will give the high tumor aggressiveness along with the extrathyroidal spread. So the basic purpose of the BRAF testing is to go for the targeted sort of therapy and to estimate the actual prognosis of tumor that contain the BRAF mutation. But we have identified the main gap that basically motivate us to study this mutation. Already I mentioned that BRAF V600E mutation rate, it has been extensively studied in the Western population, but no summarization of BRAF mutation, it has been reported from the Asian countries, particularly from the Pakistan. So our main purpose is to design or to propose a diagnostic and a prognostic tool that should be quick and it should be cost effective for thyroid cancer, so that we can establish a rate of BRAF on the national scale that would be of practical significance. So keeping in mind, we have designed two main objectives. We want to compare our immunohistochemistry technique with the Sanger sequencing technique, which is the gold standard method already, but we want to check the diagnostic accuracy, and then we want to determine the rate of mutation in our selected samples in correlation to the prognostic factors. Overall, we have selected 100 tissue samples that are basically the papillary thyroid carcinoma samples that have been collected from different hospitals from Pakistan. And after inclusion and the exclusion criteria, we finally selected 72 samples. And on one hand, we have done the hematoxylin and eosine staining for immunohistochemistry, and on the other hand, we have done the sequencing. Several clinico-pathological features, they have also been considered while taking the samples like age, female, and stage of the cancer. Now, here is the morphology of the papillary thyroid carcinoma variants. You can see the hematoxylin and eosine staining difference among all the slides. And in the A section, you can see that there is a classic variant of the papillary thyroid carcinoma with central vascular core, because it has the two main cardinal features, and you can see that one is very well defined sort of papilla with the central vascular core and the nuclear features. They are also well defined by the nuclear enlargement. However, the nuclear membrane is irregular and the chromatin material is very much distinct. And down to the A section, in the B section, you can see there is a follicular variant of the papillary thyroid carcinoma. It is again a histological variant of papillary thyroid carcinoma. It has a clear follicular architecture that is very much obvious, but nuclear features are classical of the papillary carcinoma. And it is associated with the high incidence of extrathyroidal extensions. And that's basically giving an idea how the lymph nodes they are spreading. And now come toward the C section, that is basically the non-invasive follicular thyroid neoplasm with the papillary like nuclear features. And this is basically considered as the pre-malignant lesions of the RAS-like group. You can see that still the cells, they are not fully going toward the metastasized condition. This is basically the pre-malignant lesion that can give us an idea that the next coming stage, maybe these tissues, they will get metastasized. And the next one in the D section, the tall C cell variant of the papillary thyroid carcinoma that are basically characterized by the tall columnar cell with the height of at least 3 times more than their width. And these tall cells, they're usually present at an older stage, and they has a large size and they exhibit more extrathyroidal extension, which gives us the clear indication that now the tumor is going toward the metastasis stage, and it can be compared with the classical PTC variant. Now coming toward our main technique that we have used, monoclonal antibody VE1 for our immunohistochemistry. And these are the pictures that have been taken from the immuno staining. And here you can see that the A section is basically the negative tissue, and the B1 is basically coming from the tissue that is more than 1 week or 1 week, and then C more than 2 weeks, or basically it is from the 2 weeks old. And the D part, that is very much a strong one, and that is not the moderate like the C part. It is giving us a clear idea that how the extrathyroidal extensions, they have been linked, and they give very good result and the binding with our antibody, and it can be compared with the normal thyroid tissues. So what are the overall results of this staining and the immunohistochemistry results? We have calculated that the BRAF V600 mutation, it is significantly associated with the tumor stage. Like we got very good sort of staining and the perfect binding of the antibody at stage 2 and 3 and so on. And this was also very much significantly associated with the tumor focality and extra thyroidal extension. They are also very much obvious in all the staining slides. However, this mutation was non-significant with the patient age and the gender, like we have expected in our clinopathological data, that more of the patients, they were from the female gender. But in this situation, we got non-significant sort of results with respect to the patient age and the gender, and the capsular and the lymphovascular invasion, they were also absent in our staining and the immunohistochemistry. Here, the Sanger sequencing results, we have performed the particular area for exon 600, that's basically covering the transition from T to A, and you can see that this is the cancer tissue cell, and you can see that the T that is present in the normal tissue, it is being substituted by the A. So this transition is very much clear, that is on the codon 600. So what are our findings and final conclusion and recommendation? Actually, we want to compare both of the techniques, like Sanger sequencing, that is the gold standard sort of technique, but we want to introduce immunohistochemistry using VE1 antibody, which we found that it is strongly concordant around about 98% with the sequencing. And we found that this is more cost effective as compared to the molecular testing, because it does not need that much budget, just like the sequencing, and it consumes very less time as compared to the sequencing. And we also have the results that show that 99% our immunohistochemistry results, they are sensitive. So this antibody, it is very much sensitive, and it also gives us specificity like 100%. And we have also calculated 100% positive predictive value, more than the Sanger sequencing, and the 97% negative predictive values, they have been calculated. So due to the high diagnostic accuracy, like 100%, this technique, we can say that it can be used instead of sequencing for clinical implementation in routine diagnostic and surgical pathological laboratories. And the overall conclusion, I can't say that we have recommended that immunohistochemistry is the best as compared to the Sanger sequencing, but we can just propose that this VE1 immunohistochemistry, it is an adjunct tool for the prognosis and detection of the BRAF mutation. And it could be an ideal target for precise medicine, and we can design the targeted therapy at the population level and also at the individual level. However, and the future study needs to add more tissue samples and also more blood samples, and it should also be carried on the in vivo study, so that the authenticity of this VE1 immunohistochemistry technique, it should be implemented for the further clinical trials. So this is the comparison, and this is just a proposal that this diagnostic tool, it can be used for the routine diagnostic and the surgical pathologies. And so this is the overall findings of this study. I hope so that you have a very good understanding of this topic, and thank you very much for your time and listening to me. Thank you.